process. So if we could start with Chuck Green and just go around the table.
Thank you, and Tim and Cindy, everybody, thank you for putting on this event. It's very informative, even to those of us who've been working with you for about 12 years since we met down in Hartsburg on a variety of these issues. I wish I could say that we were making progress, but we've actually regressed from the time that we met 12 years ago and began working on a lot of these issues. Some things have gotten better with some legislation that Vicki Radke-Wilson and others passed in terms of some parity, but we have really regressed. And what's sad is when we do get in these difficult budget times, what often happens is the first cut comes to mental health services. I remember when we began hitting this budget crunch about 5 years ago, there was a small program, $170,000, that was here in our community that provided mental health services to children 0 to 5. And the legislature said, well, who can even know if somebody has that when they're 0 to 5? They're probably just being kids. Yeah. And Ken Jacob and I fought tooth and nail to be able to keep that program that Dory and Barb ran in this community. But then the very next year, we get a different administration, and we get the massive cuts that have come to community mental health centers and have had ripple effects, not just to the families that are affected by it, but the communities. The sheriff of Randolph County told me last week that he now brings 4 commitments a month down here to Mid-Mo, which is taking up 4 of those precious beds because he doesn't have a community mental health program that he had for years to be able to treat people in his own county. And that's happening in every county that's around us. And I understand the value of those beds because a year and a half ago, I ended up in a situation where I had to have my own brother committed, who had a physical disability, and then you add that in with a mental illness, and the problems that come. And I understand what Jared talks about with these families. It wasn't easy to be able to get that bed, and I don't know that he would have lived another week if I wouldn't have had a local judge who was willing to even sign the commitment order. And then we ran into the problem after 40 days of trying to get him into a substance abuse treatment center when they said, we won't take anybody with a physical disability who has this problem, which is completely against the law. As Tim knows, that's an absolute violation of the ADA. But you have time to go to federal court when that family member's in need. That's going to take 18 months when they might not survive if they don't get these services. So we are fortunate to have those services. But they won't last forever if we don't have people in the legislature who are willing to stand up and say, we're not going to let Mid-Mo get closed down. If we don't have people who say, we can't cut these community mental health services, we can't overload this system, and we've got to be able to provide people with the care they need to be active and progressive within the community. It's a challenge all of our families face. It's a challenge that I dealt with on the 6 years that I served on the Missouri Protection and Advocacy Board that Mary Lou Busbarger got me involved with. And it's a great challenge that faces everybody that's up here as they go down to Jefferson City, and making sure that the least of us, those with the most difficulty, being able to stay and participate in society, can be there and be safe in our community. So thank you for your stories. They're ones that I know well, and ones that I look forward to continuing to try to work with you on and get us back to where we used to be just 4 or 5 years ago.
I'm Kurt Schaefer. I want to thank you all for inviting me here. A couple of things. First of all, I'm a lawyer, but I come from a medical family. My dad is he died last year, unfortunately. He was a medical doctor. I have two nieces who are medical doctors, one who recently graduated from St. Louis University at the top of her class, and she went into psychiatry. And she was strongly discouraged by her professors from going into psychiatry because the point was, they said, there's no money in that. She's an extremely bright woman. She's extremely dedicated to helping people with problems. She was dedicated to go into that profession, and she's doing an outstanding job, and she works at one of the clinics in St. Louis, at St. Louis U, that actually, I'm assuming, is probably the place that most of the people here who have talked about. I will tell you that I could probably go to that chair and give you plenty of stories. I have a brother who's 11 years older than me who was diagnosed with a serious mental illness at age 18 when I was 7. I dealt with that my entire life. And there is no doubt the impact that it has not only on the individuals who have the illness, but the families. And it does tear families apart. It's extremely difficult for some families to deal with. And it's not just a Medicaid issue. Mental illness affects people at every socioeconomic level. It is a parity issue. And it's not a Republican issue or a Democrat issue. And as Tim said, and I know Tim worked very hard on that bill for parity, but that was a majority Democrat legislature at the time. Both parties are to blame for the situation that we are in now. The Medicaid cuts in 2005, no doubt, were very painful. The situation that allowed this state to get to that point, that required difficult cuts, however they were going to be made, is inexcusable as well. The people who spoke here today are preaching to the choir. These are very personal issues for me. I'm a lawyer. I help people solve difficult problems every day. I've helped people draft special needs trusts for family members who have mental illnesses as well as physical illnesses. I helped draft those exact documents for my own parents. Thank God we did that before my father died. I think those are extremely important issues, not only from the perspective of everyone understanding what it's like to have a family member with a mental illness, but to understand all the things that go along with those families. Not just the day-to-day and literally getting through every day, but the long-term planning issues, the long-term funding issues. Those are all issues that are very important for me. I think the issue is, and I know that Congress is looking at this, but the first step is absolute parity. Whether it is Medicaid or whether it is a private employer, it is absolute parity. Why don't we have it now? In large part because private insurance companies don't want to pay for it. And so when you look around and say, why haven't we gotten to that point yet? You've got to look at who those insurance companies are giving money to. You've got to look at whose ear they have, whose citizen community active groups like this do not have that type of access. It's simply the reality. Is it fair? Absolutely not. Do we need a stronger voice in the General Assembly, both in the state of Missouri and in Congress? Absolutely. It's those special interests that need to understand that they are allowed to provide a business and a service in this state, and they need to cover everybody who needs those services. So if I'm elected to the Senate, that'll be one of my first priorities. It's a very personal issue for me, and I think it affects pretty much everybody in our community. It's something that's been put aside for way, way too long, and it's time to deal with it.
I'm Mary Still.